Hi everyone, this is Dr Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Today we're talking about Degenerative Suspensory Ligament Desmitis, or you might have heard it talked about as DSLD. Based on one study, predominantly Peruvian Paso horses, they renamed it equine systemic proteoglycan accumulation. But the cause and the diagnosis is not actually definitive, and we have to question, do we really have a population postural problem that is causing suspensory degeneration?
We are discussing the currently available research and how a dropping fetlock may not be synonymous with DSLD, as well as what you can do to support the distal limb. So, DSLD, what is it? It's a systemic disease of the connective tissue with alterations in proteoglycan concentration as described by these studies. So, a proteoglycan is a naturally occurring protein in the extracellular matrix, so it fills in the space between cells, but they can also serve as a lubricant. They create a hydrating gel that helps in high pressure areas. So this condition may involve more than just the suspensory ligaments, as discovered in a study in 2006 of 28 horses. It found excessive interfibrillar proteoglycan accumulation in other ligaments, as well as the eyes and the cardiovascular system, for example, the aorta. And in this study, it was found that Peruvian Paso horses are overrepresented. So did you have any comments about these studies, Raquel?
Yeah, I mean, that study, what was it? 22 of the 28 horses were Peruvian Paso horses. And, you know, I've heard DSLD thrown around a fair bit, and I thought there were actually more studies on it that showed it in other breeds. But then when we've kind of looked into it this morning, I had my suspicions that the dropping fetlock that often is diagnosed as DSLD isn't. But there's actually not really any other, good studies with a number of other breeds in it. So there's might be a study with 2 quarter horses or 2 warm bloods or 1 standard bred, stuff like that. That is not a study. That is not enough numbers to clarify this disease. So there's no breed studies that have linked suspensory desmitis to being a systemic disorder, except for the Peruvian Paso study. And then there's another one that came out more recently, which is disputing that fact that it is a systemic disease, because that's not what they found. There has been some genetic studies where they think it's a polygenomic problem, so there's multiple genes that could be involved in this. However, there's no way of genetic testing at this stage to determine, whether a horse is prone to it. There was one study that showed that warm bloods can have a higher degree of type 5 collagen. And I mean, we definitely do see hypermobility as a predominance in warm bloods. And we have to ask how that just overall affects postural support. Sometimes this diagnosis of DSLD is around 10, but then there were studies that talked about seeing foals with this kind of generalized soft tissue disorder. But again, I'm going to ask the question, do we really have a loading problem rather than a primary degenerative problem? Is it the way that we're training our horses, which is leading to us thinking that all of these horses have DSLD? But, even my experience with Ellie and all of her pelvic issues, her fetlocks cop it. And also with Jelly and his muscle disorder, he also has chronic lumbar and sacroiliac and hip and pelvis and iliopsoas dysfunction. And yes, I see a massive drop in his fetlocks when he is in work. When he's standing in the paddock, I wouldn't say his fetlocks are more dropped than any other horse. And I think, the horses where there's this really chronic degeneration, they're probably the horses that we see, like all 4 fetlocks are more dropped. We see that there's pain associated with it and discomfort. They don't want to load the other limbs. But I would still, ask the question about general whole body inflammatory process going on that's affecting the soft tissues. So, Soph, do you want to explain a little bit about ligaments?
Yeah, so ligaments are a type of tissue, a soft tissue in the body, and they go between one bone to the next bone, usually next to or across joints. And so they bind the bones together and they allow the joints to move in certain directions through the natural joint vector. And the ligament is there for stability and integrity of the joints. It prevents them from twisting and dislocating. And the fetlock itself actually has a lot of ligaments. Like they have a lot of, ligaments supporting the fetlock. So they crisscross in lots of different directions. They go like down the sides of the ligament. They sort of have a crisscross across the back of the ligament. It's very secure, but we're talking about one large ligament that goes all the way down the back of the cannon bone. It wraps around behind the fetlock, and then it wraps, there's 2 branches of the suspensory ligament. So it basically forms like an upside down Y shape, and then it wraps around both sides of the pastern. And usually you can see it. If you have a look at your horse's pastern, you can actually see these 2 lines that come across both sides of it, and they point down towards the front of the top of the hoof. And those are the branches of the suspensory ligament. And so ligaments themselves, they're right through the body. We're discussing the suspensory ligament. Something interesting about ligaments is that they also support some organs in the body. So there are ligaments that hold up, say, a uterus, they hold up the intestines. So they're really quite diverse and broad throughout the body. They're made up of parallel fiber bundles of collagen and elastin. And so they're both quite strong, but very elastic, and they're very good at energy storage, and they're very good at rebound. So they are the ideal kind of tissue to aid in biomechanics and motion. And we actually just did an episode on the nuchal ligament, which is another example of a large ligament in the horse's body that allows for a lot of stretch and recoil of elastic energy. So how would you describe the difference between suspensory ligaments, which is what we're discussing today, compared to tendons in the distal limb?
The suspensory ligaments, like you said, in the distal limb, there's a lot of ligaments. So there's suspensory collateral, sesamoidean ligaments, and that's because the distal limb needs a lot of support, because there's a lot of loading that goes through a fairly narrow structure, compared to the size of the rest of the horse. The legs of the horse do take a lot of load. And so as you mentioned with the suspensory ligament, like one difference is that it comes from the back of the cannon and then goes behind the fetlock around the sesamoids and then to the front of the pastern. So whereas the other tendons in the leg, which are tendons because they have associated muscles in the upper limb, so you've got your flexor tendons, which have flexor muscles up to the elbow, and then you have and they're on the back of the limb, and then you have your extensor tendons on the front of the limb, which have the extensor muscles, above the carpus up to the elbow. So the tendons have an important muscular component to them that provides them with actually the stretch, because tendons don't stretch much. I think it's 8% of stretch in tendons. And ligaments, even though they're very elastic, they don't have a huge amount of stretch. So they're elastic, and that recoil mechanism is what's really important in those tendons and ligaments for the distal limb, the recoil of support, but it's the muscles up higher that support those flexors and extensors that allow for bigger ranges of motion in the limbs. The difference that I see under dissection is that when we do a cross section of the suspensory versus the tendons, there's a very different growth structure. So obviously I'm not looking at the histopathology under the microscope, but I can see the difference in fiber thickness, color, and kind of space between the fibers as well. Like the suspensory is quite dense, and it does have a different color compared to the flexor tendons and the extensor tendons. The other thing I would say is I've dissected a lot of distal limbs. So I was doing it every year at CSU at Charles Sturt in the equine science program, and we would look at, 10 or 15 limbs at least, plus all the dissections, whole horse dissections I've been a part of. And like pretty much every single horse has degeneration in the tendons and the suspensory of the lower limb. And they haven't been diagnosed. Like we have the history on a lot of horses that we have dissected and they're not diagnosed with tendon injuries, but there's so much degeneration in the distal limb. And the other thing that I see under dissection is that the suspensory, often there's a lot more muscle fibers that have been laid down around the suspensory. And the difference with suspensory healing is that it can heal with muscular fibers as opposed to a tendon injury, which doesn't tend to lay down those muscular fibers. So suspensories are much better at healing, but then they also have a really important support mechanism. And the suspensory used to be known as the interosseous muscle. So it did have a bit, there was a bit more of a thought process around it being more of a muscle than a ligament. But then, it does go bone to bone, and that's what classifies ligaments. And it is definitely much more supportive structure than a muscle. And it doesn't have, it's not 100% muscle fibers. There's ligamentous fibers, higher degree of collagen and elastin fibers within that. But if you lose the support and elasticity of the suspensory, that's when you lose suspension in the horse. So often these horses with the drop fetlocks, like they're lacking the, the phase in the trot where all the limbs are off the
suspension.
Suspension, yeah, it's just suspension phase. I'm like, they lack that suspension phase, so they lose a bit of their bounce. So when you're riding them, they don't feel as airy. Yeah, they feel flatter. And so, those suspensory ligaments are often a big part of that rebound recoil effect that you feel with those big floaty horses. But then the more suspension that they have, the more loading that the suspensory comes under. And so then if there's, an overload, which can just be a work overload, then those ligaments start to get strained. They don't have enough recovery time, and they're not able to store the energy, when they land, and then transfer the energy back to promote that lift appropriately because their elasticity has been compromised. So, yeah, I'm going to kind of argue that a lot of horses with drop fetlocks are due to suspensory overload issues rather than DSLD, and that it's a human-created problem, not a genetic problem. I think, yes, we have horses with hypermobility, different makeups in their collagen. I'm not arguing that it doesn't exist, but I just think it's probably over recognized when it's actually a whole body postural problem. So what kind of presentation might we see when we're leaning towards more of a diagnosis of a generalized degenerative suspensory ligament desmopathy or desmitis?
So some of them are going to be more generalized. So we're talking about possible presentations. Some of them are going to be more generalized that you would see definitively with other things. Like there are lots of symptoms that overlap with other conditions, as well as a chronic inflammatory state. But some things that you might see are going to be drop fetlocks in all of the limbs. So it's going to look like that fetlock is really sinking down towards the ground rather than staying nice and in a normal aligned state between sort of the hoof up to the cannon bone. You might see heat and swelling through the fetlock. So often they look very lumpy and they get warm and they can be, it looks like all the blood vessels and things are sort of standing out and they're a bit bulbous. It's also important to note that when there's a difference between horses that are moving and standing still. So if your horse, when they stand still in the paddock, has a really nice posture or alignment through their fetlocks, but then when they're moving, they don't have a nice posture. So that when they're walking, it looks like they're really dropped. But as soon as they stand still, they have, the shape of that pastern coming up into the cannon bone is very normal. Then that might be something to bring up with your diagnosing veterinarian and, whatever professionals you're working with, because it's valuable information to compare with a horse that when they're standing still has fetlocks that look very dropped. Because the distinction between those two might be the way that you move contributes to how you would load through your joint. Whereas when we're talking about these degenerative conditions, you might be more likely to see a fetlock that's closer towards the ground because the changes throughout the suspensory are leading to it being unable to have more tension and hold the fetlock up higher when they're standing still. So when you do reach that late stage, they are often very dropped in all four limbs and they have big, large fetlocks. They often trip and stumble because they can't use their fetlocks properly. And so they often also have back and body soreness because the body is compensating for those changes in limb alignment, both when they're moving and when they're standing still. So horses that are upright for 20 plus hours a day, they're loading through those structures that have changed. And so you also often see changes in behavior. So they're often irritable. They're unwilling to go forward or move around. They often stand around a lot in their paddock and don't move a whole heap. They often shift their weight bearing a lot. So they'll alternate resting a leg. They'll go, oop, I'm on my left hind and now I'm on my right hind. And they in the studies talking about the horses with DSLD, they position themselves to point their toes down to offload. So they might dig a little hole in the paddock and point their toes down. They might seek out that posture in the stable. They might lean on things. So they might press their bum on the stable wall, or they might sit down on a rail to try and offload their legs and support themselves. And when you do have sort of this chronic achy feeling, sometimes it feels good, I know personally, to just put yourself in a different position. But when you enter that different position, once you stay in it for a little while, it also gets achy. And then you shift back to another position. And so you end up in this loop of not really being able to find any meaningful comfort anywhere. And so you shift a lot because if you overload one thing, you offload it and then you overload something else. But it is important to recognize that many of the symptoms we just talked about, like changes in behavior, being irritable, unwilling to go forward, move around. Just in the clinic that I was with you last weekend, there's a horse who's decided they're unwilling to move forward and they're maybe a little bit irritable, but they're not showing those symptoms. Even though they don't have amazing posture, they're not showing those symptoms of really dropped fetlocks when standing still. So there's going to be overlap. And it's worth being mindful that when people make offhand comments, because we're starting to hear it much more. There's awareness growing about the condition. People say, look into DSLD, read this article on DSLD. But when we when we did that this morning, we read a number of different articles and research papers. The only place that has, as you were saying, has a proven systemic link is the Peruvian peso horses. So while there are a lot of there are good, reputable companies writing articles about, this looks like DSLD, it's this exact thing. It's important that when you go back to the research, it may not be as definitive as it sounds like in a lot of articles that people are reading. So just being mindful and sharing this episode with anybody that, you think their horse has, people are talking to them about DSLD, or they're saying, oh, I think my horse has DSLD, or my trainer says that my horse has DSLD, to be considering the horse from a more whole perspective. So Raquel, why does it happen? It's a big question because we're talking about degenerative condition or chronic conditions or postural conditions. But if you were going to look at as a bit of a whole, why does it happen?
Yeah, they're definitely trying to investigate a genetic link, and there's like linking some genes, to potential increase in incidence with degeneration in the suspensories. I think if you've got a foal, that's presenting with a lot of laxity and fetlock dropping and this kind of already chronic inflammatory state, like you're going to think about what's going on with their soft tissues, like what's going on with their proteoglycans and their collagen matrix, and is there a general, and especially if they have like funny skin, their skin is kind of bunching weirdly, like the skin's made up of a lot of collagen. So if you're seeing a generalized issue that's starting from a young horse, then I'd suspect some kind of systemic collagen disorder, which, it's just not easily diagnosed in horses because you'd need to do a biopsy and have a look at it under generally an electron microscope and using the right stains to look for, types of collagen and and the proteoglycans, etc. As we said, the studies have been highly skewed towards Peruvian paso horses, which in Australia we really don't have. I've never met one in Australia, like they're not that common. And those type of saddlebred horses. So, it could be more of a condition that is predominant to those horses, although then there was another study that didn't find a systemic link and they classified it as more a suspensory specific problem. But for me, I think when we're seeing a dropping fetlock in your horse, you need to consider it as a chronic postural dysfunction of the pelvis and the spine. There has been numerous studies that talk about the transfer of forces, within the hind limb through the, hips, through the fetlocks, hocks, stifles and hips, and how if your upper body is not functioning properly, specifically hips and pelvis, how it's going to increase the loading on the fetlocks. And I see that very commonly. So Jelly is probably a big one that's showing that to me, and I know his dysfunction. Like I know that he definitely has had a iliacus tear. I know he's had numerous psoas injuries. I know he's tied up a lot of times in his life. I know that he has a dysfunctional lumbar area, and I know that his pelvis is asymmetrical. And I also know that his hips get tight and sore often. And that he had chronic kind of postural weakness. When I met him, he couldn't carry, he'd run, he'd lose his balance, he'd take off, all of those kind of chronic postural problems. And I also know when he's out of work that his fetlocks get worse. I know that sand makes him worse, but he has an underlying muscle condition. And so, like at the moment, he's not been in good work for ages because he had a foot lame. I was unwell. He had a foot lameness problem. He's still got a foot problem. And so he's had a fairly long period of it's probably the longest period of not continuous work that he's had. And his fetlocks are sinking quite significantly at the moment. So I only work him on firm surfaces to try to reduce the strain through the suspensories, but he would be a great candidate for suspensory desmitis if I overloaded him. And he probably does have degeneration in his tendons and ligaments because he did many years of eventing and jumping and dressage and, training. So, I think we have to look at pelvic function. We have to recognize the influence of entheses dysfunction, which is like muscle attachments to the pelvis. We have to recognize the influence of core function, but specifically multifidi in the spinal stabilizers and how long that takes to build up. We have to consider the influence of gelding scars. So, one of the horses that I've seen that was previously told that they had DSLD, when I looked at the way he walked, I'm like, gee, he looks like he walks like a duck, in that he was kind of crouched behind, he turned out his hind legs, and I felt his gelding scar. I was like, holy moly. It was one of the worst gelding scars that I've ever palpated. And I'm like, well, that's going to cause significant pelvis dysfunction and overloading of the fetlocks. And in mares, you could have ovary tension and ovary issues, plus or minus psoas and iliacus injuries that are meaning that the pelvis and the back can't function optimally and are overloading your fetlocks. So we really have to look at the whole postural function of the horse. And I've seen trainers say that they've rehabbed degenerative suspensory ligament desmitis. If it was truly a degenerative condition, you would have a lot of trouble rehabbing it because the ligaments do not respond the same way. Like it's degenerative over time. But if it's postural pelvic dysfunction, then you're going to have success in rehabbing it if you do it under the right circumstances, i.e. surfaces, postural work, you really get that pelvis and core and back functioning optimally, then you should have good success with rehabbing this. So you'll still have some degeneration because there's probably been damage done to the ligaments and the tendons. So they don't heal, they generally don't heal back to what they were before. So, but you're helping reduce the loading by training the posture. So, yeah, that's a long-winded answer about why it potentially happens. But if someone did want to kind of get some diagnosis, what would be the things that they would look for with their vet?
Yeah, I mean, we've talked about the clinical signs, so you'd be looking for those things, you'd be suspecting something's going on, or maybe you've had your vet out and your vet says, oh, I've noticed this and I think that there's a possibility that this is relevant for your horse. Ultrasound being used, you'd want to be doing a repeated ultrasound over time to define degeneration, because looking at the tendon once isn't going to tell you about whether or not there is proteoglycans in there, and it's also not going to tell you whether or not the state of the ligament that you're seeing on that day is changing in relation to a timeline, so degeneratively. So you want to be looking for signs of degeneration over a timeline. So that might look like spacing out an ultrasound over a number of months to have a look at what's happening. What they have been doing in these studies is looking at gel chromatography on tendon samples. So what it does is it reveals increases in proteoglycan concentration compared to a normal ligament. And generally it's done post-mortem. So once a horse has already passed due to the risk of a biopsy. So you're taking a sample of that tissue. So, taking a sample from a suspensory ligament, you're always going to be,
risk.
If there's, if you've got a horse that you're just like, I'm a bit suspicious, it's really something that is going to, cause a lot of issues for your horse, taking a sample of their suspensory ligament. So, generally done post-mortem. And as Raquel was saying, there's genetic testing for biomarkers, but they're still working on this. So proteoglycans being a protein, they're made from RNA strands, which are made from DNA strands. So the way that works is that they can understand which portions of the DNA are contributing to this particular issue, and then they can say, okay, we can test for which horses have this particular biomarker, and so that tells you whether or not a horse might develop it in the future, or if they maybe do have it at the time. So, palpation, also very important. That's going to be for pain. It's going to be for maybe the texture of the suspensory ligament, having a feel of the structures all the way from the top, all the way down to the bottom, comparing from one side to the other, comparing all four limbs, as well as looking for comfort and mobility in the assessment, but also in how they move. So going through the fetlock range of motion and having a feel of that suspensory ligament and how it wraps around the distal limb. Testing and diagnosis, as we've said, it's one of those things that wants to be integrated with the rest of the body. So if you're going to be looking at the lower limb, to be looking at the pelvis, to be having a vet in Australia, we have ABM vets, osteos and chiros, so they can tell you more about the posture and the function and the structural system of the pelvis and the hip and how they're moving through their whole limb. And they can also give you information, or qualified body workers, experienced body workers and vets who've done professional development in these areas can understand and reflect on the quality of the horse's core and spine. And, we're talking about in these conditions, it's affecting all four limbs too. So they want to be looking at the thoracic sling and looking at the suspension through the upper half of the front limb and the hind limb. So the whole body evaluation. And then we've talked about the timeline of ultrasounding, but looking at the timeline of what happens when we're going to talk in a moment about what you can do to support the horse, whether they have DSLD or they have some kind of loading issue. The idea that you can also be looking at a timeline of what happens when you introduce positive postural work or other things that are going to influence the horse positively. So that's going to give you information about whether or not the horse is improving in relation to what you were just saying, Raquel, about trainers who've said that they've rehabbed out of a DSLD. So if you are going to see positive changes, one, if our aim itself is to improve the horse's well-being and welfare, then your skill as an owner or accessing trainers and practitioners who can make evaluations about what your horse looks like over a timeline and whether they're improving is going to be important as well for understanding what's happening with your horse. So if we were going to talk about what you can do to support, what would you tell people that they can either use to support their horse or what they can look at to gain more information?
Yeah, so really looking at the quality of motion through your horse's back and asking yourself whether there's brace in the back and whether the back swings in more of an upward motion or a downward motion. So we had a good example at a clinic on the weekend where when we first asked the horse to trot, and he did have dropping fetlocks, and we might talk about this him specifically in the next episode, but he did have dropping fetlocks. When we asked him to trot, he braced his back. He has worked to a very high level, and now his owner's kind of unraveling a lot of layers of compensation. Then when we put a T-touch wrap on him and asked him to do a transition, his back became downward swinging, but he softened. And so he let go of the brace. So then it's telling me that his deep muscles aren't strong and supportive yet, and that when you let go of him holding the big muscles, that he has a downward swinging back. So what we don't want to do is load a horse that's either bracing through the back or has a downward swinging back. And this has been one of my biggest challenges with Ellie, is that I have struggled to get her to a position where she's got a strong upward or at least not downward swinging disengaged pelvis and downward swinging back in the trot. So the trot, the back should be fairly stationary, but it shouldn't look braced. It should look supported in that stationary position. And if you've got good suspension, it'll lift up a little bit. So I think we often overload the back when it's not strong enough, especially when we go and break a horse in it for 6 weeks and they get kind of loaded or done something with every day and they haven't done a lot of in-hand or postural work to establish good multifidi. So we should then progressively load the back and the core. So, think about how we can build that up rather than, okay, now we're on the horse, now we're walking, trotting, cantering. Within 3 weeks, we've got them walking, trotting and cantering and riding for more than 20 minutes. That's not appropriate loading. We also need to look at doing postural training before we load the back, which we've, talked a lot about in a lot of our different episodes, so that we're making sure that we're activating the right muscles, and that they're holding themselves, that we're not using training aids to put them in a position, that they're actually able to hold themselves and go around in that position without a rider before we load them with a rider. We just need to take more responsibility as horse owners to observe for correct biomechanics. So, start it like knowing how your horse's fetlocks move, knowing what your horse's back looks like, looking at your horse without the saddle on, learning about like how a good pelvis should move, learning about how a fetlock should load, and just improving our observation skills all the time are so valuable. We also want to create variation in our training, especially so we're not always training on sand. Like, I'd love to know the proportion of especially dressage horses that spend, 80% of their time training in a sand arena. And we're just overloading those suspensory ligaments all the time. And we need to create more variation in the training. So, they might do a couple of days on the sand, and that's controlled loading so that we're reducing the overloading. And then, they're out. They're either trail riding or they're out working on grass or, they're out working on different surfaces to reduce the constant overloading of the tendons and ligaments of the lower limb. Also, this is a big one, and it's really commonly used, but do not use tendon boots or bandages. You've got to ask yourself, why do we do it? Why? I've asked people these questions and often their answers so they don't knock themselves. Well, why is your horse knocking themselves? There's a problem there. There's a proprioceptive issue. There's a balance issue. There's a stability problem. You should not need to use tendon boots or bandages. The only time would be when cross country, just in case your horse overreaches, and that could create a significant tendon injury, or sometimes with obstacles, but I would still, I don't float my horse with boots, right? I want my horse to know where their legs are, to feel their legs. And also I've had so many of them get tangled up in float boots that I just don't. And also they're just adding heat. So there's been numerous studies done where they've looked at the addition of boots and they found that tendons they generate a lot of heat. The tendons and ligaments of the lower limb, they've done studies to show that they can get up to 42 degrees or so, which is the point at which you start to get degeneration in the cells. It's cooking them basically. So we add a bandage on top of that, or we add tendon boots, no matter how aerated they are, we are adding heat. We're reducing heat dissipation of those tendons, and so therefore we're increasing degeneration. So please don't use tendon boots or bandages. Also, if your horse does tend to have a degenerative, if you're thinking they have a degenerative condition, like you've looked at sequential ultrasounds, you've noticed that these signs are getting worse, then perhaps, and there's no studies to support this, but perhaps supplementing with things like collagen, MSM, things that support connective tissues, like really looking at nutrition, reducing inflammation, omega-3s like your flaxseed oil, anti-inflammatory herbs, millet and linseed, those sorts of things to reduce inflammation is going to be, really important. But, that's some of my things that you can do to support. What else would you like to add to that, Soph?
To reduce inflammation in the body. So whether that's because of stress, because of other factors. If you can ensure that the whole horse is really healthy, so that means looking after their gut health. It means looking after the tendons, whether you're going to be icing tendons post-work. So that is going to be very important if you're working in sand, if you've had long training sessions, hard loading sessions, gallops, jumping, etc. It's very important to get the inflammation out of there. But considering it as a whole body. So thinking about their joints as a whole, thinking about their comfort as a whole, thinking about their stress levels as a whole. How is your horse managed? Is their lifestyle a rest and digest kind of lifestyle where they have a space to go and truly heal and to rejuvenate, I suppose. It sounds almost funny to say that, but truly, when
the tendons take, it's like 2 to 3 days to fully recover, like in terms of the cells. And so if you've had a hard loading on your tendons, you need to consider what work you're doing for the next 72 hours. And that icing has been shown to significantly reduce damage in the tendon. So icing for at least 20 minutes post-work, especially if you're at a competition, your endurance horses, your jumping horses, all of those, especially if you're using boots, you need to get ice on those tendons, or ice boots, which aren't as effective, but ASAP, to reduce that inflammation and promote the healing of those tendons as soon as possible.
So some other things that you can do is taping to support the suspensory. So when you're talking about DSLD as opposed to a suspensory injury or what you are taping for, so DSLD, the kind of taping that you would do, and we're talking about kinesiology taping. So it's like a stretchy tape that you put on your legs that we've talked about before. We should do an episode on taping.
Yeah, actually. We should actually.
Yeah. Think of that. So taping, a DSLD taping, I've seen a lot of horses who have DSLD, putting the taping on for that. They've had a lot of comfort in the short term, proprioceptively and also supportively for those ligaments. You can also tape in a different way for acute injuries. So that's going to be different. The things we've talked about with overloading your tendons to, when that is not coming through just the DSLD. But taping to support the suspensory is very, very useful. But also looking at the whole body again when you're taping, because often it's a loading issue. Rehabbing the body, so decreasing load through the fetlocks. The studies that are available talking about how hip mechanics and pelvis mechanics influence the loading through the fetlock means that we can influence this loading significantly, because we can influence the hip and the pelvis significantly through body work, through postural training, through changes in management, and even changes in warm-ups, the quality of your warm-up and the way that your horse uses their body with you implementing activations and stretching after work changes their body so much that you can really, change the way that you load through the fetlocks. Your hoof balance is going to be very important. So the suspensory wraps around, we talked about, it comes down the back of the cannon bone, it wraps around the fetlock, and it comes forward and it attaches onto the front of the hoof, which is different from the deep and superficial digital flexor tendons because they come down the back of the leg and they attach onto the back of the hoof and the back of the pastern. But your hoof balance is very important for the balance of tension in all of those structures, both medial-lateral, so side to side, and also with the hoof pastern axis and breakover, and also for the alignment of the coffin bone, so the plantar and palmar angle of the coffin bone inside the hoof. So all of that is very important. Hoof balance, very important. And breakover also contributes to the level of strain on the suspensory. So if you think about the center of rotation of the hoof capsule itself is, where is it? It's basically at the point where, is it in the coffin bone or just above the coffin bone joint? I can't remember the exact
center
point.
of rotation. It's about in the middle of the frog, also like about a third of the way down the frog as well. So it's like where the collateral grooves, there's a little change in the collateral grooves where that center of rotation occurs.
And so that area needs to be equidistant in front of that point and behind that point on the bottom of the hoof. If you have a long toe, then you're going to be increasing the level of strain through the suspensory as the horse breaks over. And the breakover happens every time the hoof leaves the ground. So if you think about how many steps a horse does a day or should be doing a day, a change in the hoof balance is going to significantly decrease strain on the suspensory ligament. And of course, looking at pelvic and spinal function, having appropriate spinal stabilizers and core activation, because the horse's barrel is very important for the ability to coordinate stability, especially when you take a limb off the ground, when you pick up a limb, everything. It's a point of stability between all the four limbs that have to pick up and replace on the ground. It's very important. So they would be my comments for people supporting their horse. Do you have any other thoughts on support or other ways that people can help their horse or work out DSLD issues?
I think I'd probably just touch on some takeaways now. Like I think probably the biggest things are create variation in your horse's training. Be aware of how do you actually look after your horse's tendons. So knowing, when you need to provide ice, avoiding boots, and appropriate, nutrition and general postural support would be the main things. And also recognizing the difference between when a horse has like generalized inflammation where all the fetlocks are sore, swollen, showing that inflammation. If the horse is showing that degree of inflammation, they're going to benefit from supporting those fetlocks. Whereas if they've just got a stinking fetlock but they're not showing any degree of pain in the area, then you need to definitely support the upper body. So I think you'll get more benefit from taping fetlocks when there's active inflammation, active discomfort within the area. But I would also support the upper body with taping in that situation. And if they're dropping and there's no obvious pain, discomfort, inflammation, heat in the tendons, then you need to look at upper body postural control and just general kind of inflammatory nutritional support. I would also say with hoof balance that you need to take it back to a maximum of 5-week cycle in your trimming or shoeing cycle, and possibly even less if you're actively rehabbing and you have active inflammation in the area. Then I'd probably try to take it back to 3 weeks to reduce that strain as the hoof grows that's being placed on the suspensory, and also consider the strain to them when you are trimming them. Like, how can you improve the comfort in that situation as well. Red light could also be beneficial, like having red light wraps. That's also good for, icing, and red light are really good for tendon and ligament recovery. So if you're serious about competing and long rides and things, then having a red light wrap and ice boots in your toolkit would be super important. Just some takeaways.
Definitely knowing how to palpate your horse's ligament and tendons. So we might pop an image in the email that goes out with this podcast. So definitely make sure you subscribe to the Equine Functional Posture Podcast mailing list at your website, Integrated Vet Therapeutics. Because if you want to have a look at the structures we're talking about, we'll include an image about that as well. But knowing how to palpate them, so whether or not you, I don't know if any of the first aid courses actually that are held by.
Well, in the new membership group, which is just being launched soon, in the Equine Functional Posture Hub and Collective, the very first exercise is palpating your horse's distal limb. So, that's part of our Equine Functional Posture course, and it's also part of the palpation exercises in our membership group. So it's definitely a very valuable skill to have that every horse owner should have.
Yeah. Yeah, and just, in general, looking after your distal limb. We've talked about heat dissipation and being mindful of the order of training days, because recovery is very important for those structures in the lower limb.
Yeah, and I've had horses that I remember years ago there was a mare, and I'd always check her suspensories. I can't remember why, but she had chronic postural issues. But yeah, I could tell when the loading session had been too much because she got really sore in her suspensories. And then if she'd had a training session or a competition and I palpated those suspensories and they felt great, I was like, awesome. But palpating them, knowing what is normal for your horse, knowing if they stay sore just for 24 hours or if they stay reactive for 72 hours, or if they're still reactive after that, you need to get them investigated. It will give you an idea of how much the loading has affected them, and then what their recovery time has been in that situation as well. And that's how horses end up with proximal suspensory desmitis as well, which is commonly diagnosed in the hind end, and I believe due to pelvic dysfunction, because they're just chronically getting overloaded and they're not having enough time to recover, and then they're going back out in the sand again, or they're going back out and jumping again, or they just have chronic postural problems in their hind legs, or they have poor angles of their hind feet, and their suspensory ligaments are just never getting time to recover. And then we've got a horse that's all of a sudden out for a long period of time because their suspensory ligaments are so inflamed.
And then if we don't get on top of the original issue, then you don't ever have a recovery that's meaningful or what you're really aiming for.
Yep, exactly. Awesome. Well, thank you for joining myself, Dr. Raquel Butler, and Sophie Vanderberg in today's podcast. Hopefully it's given you some things to think about with the sinking fetlock. Enjoy your horse time. Please subscribe to the Equine Functional Posture Podcast so you don't miss our weekly episodes. And we love a 5-star rating so that we can share more valuable insights. Please reach out with any listener requests for topics you'd like us to hear about, topics you'd like us to talk about. And if you're a business aligned with our mission, reach out to become a sponsor of the podcast.
And we'll see you in the next exciting episode.